Time for the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Mark Hiatt, the Executive Medical Director for Regence. Dr. Hiatt, good morning.
Good morning, Chris and Paul J.
Morning, Doc. Reading a study here which has been passed on to us by you, which says poor sleep is linked to a higher risk of death in people with heart issues. I'd like to thank you for that, since I'm having heart issues at this point in time. How big a deal is it? I was pretty shaken up by it, and then saw that it was like a 16-year study.
That's right, Paul J. There was this 16-year study by these researchers at Stanford University. And what they did is they investigated the impact of poor sleep on people who have some type of heart condition or problem with their vessels. Mm-hmm. These are people such as people who have high blood pressure or high blood sugar. And what these researchers found is that in these people, poor sleep is linked to a higher risk of death.
How much higher is the risk than with other people?
Chris, these researchers at Stanford found that the risk is elevated by 2 times. It's 2 times higher. That is, people with these cardiovascular issues who sleep poorly are about twice as likely to have died or to die at the end of a 16-year period compared to those with similar risks who do sleep well.
So how do you change your habits so that you do sleep better?
I think it's really to make sleep a priority. And, we all think about eating well and exercising regularly, but a good component of good health is sleeping well, and try to get at least 6 hours a night, if not more.
Mm-hmm. Dr. Hiatt, kids, as we know, love to have some fruit juice or some orange juice or apple juice, but pediatricians now have started not recommending it for children who especially are under the age of 1. What's going on there?
Well, in fact, that's right. The American Academy of Pediatrics has revised its guidelines, now suggesting and even recommending that fruit juice not be given to children under 1 year of age. And that's because that although fruit juice does have some benefits, it does have potential detrimental effects for children, particularly those under the age of 1.
Sugar?
Yeah, it's sugar. You named it. The high sugar content really leads to increased calorie consumption in these children, and it also increases the risk that they may have dental cavities.
What would be an alternative, a better alternative to fruit juice?
Well, really just consuming whole fruits, not the juice, but the fruit itself, which contains that fiber which is absent from juice. And also they're not typically consumed in such a way that leads to an increased risk of calorie intake.
And Doctor, most people, I think most people would like to live to be 100, or at least they feel like they would. Mm-hmm. How do the centenarians do it? Well,
there's been a lot of study of these few people who do live to the age of 100 and beyond. And a lot of them respond that they really have lived their lives in moderation. They eat well, sleep well, exercise regularly. But really there's a genetic component to it. So you really have to also, in addition to these things, choose the right parents.
Kind of difficult to do. Any common traits among those who do live so long?
Yes, a lot of these people have high levels of that good cholesterol, HDL. A few of them smoke. Many of them are lean. They don't carry a lot of excess weight. And in particular, if they have stress, they seem to manage it well.
Yeah, that stress really always seems to crop its ugly little head in there and does become a determining factor in health, especially heart health.
And, Paul J., we all have stress in our lives. The key thing is how we choose to manage that stress. We have a choice. We can react well to it, or we can let it really consume us and harm our health.
Well, Dr. Hiatt, we thank you for your time this morning on KBOI.
Thank you.
It's the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Mark Hiatt, the Executive Medical Director for Regence.